phenomenal individuals. We are coming together today and with them, hosting them here at CCHI so that they can share with us, all of us, their thoughts, their expertise surrounding this concept of relay interpreting as it unfolds within the ASL, the deaf interpreter, the hard of hearing communities that they are integrally a part of. Joining us today is Corina Gutiérrez. Welcome back, Corina, who is the Director of Community Advocacy at the State of New Mexico Commission for Deaf and Hard of Hearing Persons. She is one of 6 children in a close-knit Mexican family who attended the New Mexico School for the Deaf starting at the age of 6 and received her Bachelor of Science degree from Gallaudet University in Washington, D.C. Corina has served on many an organization's board and is currently a board member for the New Mexico School for the Deaf Alumni Association. Also joining us today is Jenny Rodriguez. Good to have you back, Jenny, who is assistant professor in the ASL and interpreting education department at the National Technical Institute for the Deaf, located at the Rochester Institute of Technology. She also serves as the department's healthcare interpreting program director. Jenny has worked as an interpreter for nearly 25 years and as an educator for the past 11. She completed her PhD earlier this year from the Gallaudet University, where she conducted an institutional ethnographic study exploring effective communication access in U.S. hospitals. Last but far from least, joining us today is Kevin Poor. He is the Director of Substance and Addiction Intervention Services for the Deaf at the National Technical Institute for the Deaf, located as well at the Rochester Institute of Technology, of course. A certified deaf interpreter, Kevin works at a local hospital as an on-call interpreter, and prior to relocating to Rochester, New York, worked in Philadelphia, Pennsylvania as a full-time freelance deaf interpreter for 7 years in both legal and medical settings, mental health primarily. Kevin is supervising partner facilitator with the Center on Atypical Language Interpreting, co-chair of the Test Development Committee for the Center for Assessment of Sign Language Interpretation, and serves as deaf member at large on the board of the Genesee Valley Region RID chapter. Kevin has led workshops and trainings on deaf and hearing interpreting teams, behavioral health interpreting, and intensive trainings on becoming a deaf interpreter. And last, but way far from least, I would also like to take a moment and thank today's ASL interpreter team comprised of Jessica Eubank and Andrea Jin, who were in fact the inaugural team to launch this CCHI ASL integrated chapter of our community conversation series. They are phenomenal and sponsored by the State of New Mexico Commission for Deaf and Hard of Hearing Persons. And so now, Corina, if you wouldn't mind, please do take it away.
Excellent. Thank you so much, Zoe, for that introduction for today. We are all very excited to have this conversation, and we hope that it will be a great discussion. Zoe mentioned that today's topic is relay interpreting. So, what are your considerations for that term of relay interpreting and how we utilize that term within our community and what changes there have been over time?
Kevin says, Jenny, would you like it? You or I can take it away. Jenny says, I got it. So relay interpreting is used often within the spoken language interpreting fields, but I'll allow Kevin to elaborate on how we used to use that term within ASL interpreting and what relay means within our communities in terms of TTY, VRS, VRI, different types of relay services that really have a very specific meaning in regards to telecommunications, and it has less to do with how it works in spoken language interpreting. So this is a great discussion, because I think most people who attend these types of discussions, the CHI members, are spoken language interpreters, and their idea of what relay interpreting may look a little bit different. Kevin, would you give a bit more information about this term and how it's used? Excellent. Not a problem. So I think it's important to have some framework for how this applies within the field of deaf interpreting, just for the sake of discussion. We'll keep the term relay was used quite frequently and has faded away kind of with the times. It did parallel with what happens within the spoken language interpreting fields, where a message is being filtered through multiple people. But that is essentially what we call interpreting within our fields. It is still the work of interpreting. So when we talk about what these things mean, working between different languages, for our community, for the deaf community, you would use a deaf interpreter or a hearing interpreter. If we used the term relay, it would not make sense. It's just not frequently used. But I think it's a great topic for discussion to begin this discussion, clarifying that that term may not even come up again during our time together today.
As Jenny mentioned, VRS, video relay service. I'd like to talk about video remote interpreting, also known as VRI. What is the difference between that VRS, video relay service, and VRI, video remote interpreting?
The concepts are functionally the same. However, one is more of a telephone system. It's funded by the Federal Communications Commission, the FCC, and VRI, video remote interpreting, is when there are not available on-site interpreters, you can get interpreting services through a video monitor. So you can receive that same ASL to English interpretation and English to ASL when you don't have an on-site interpreter within the room. So that the functionality is the same, but the funding mechanism is different. I've noticed that, especially with the pandemic, that use of video remote interpreting has been on the rise. And Jenny says, for healthcare, VRI is typically used, not VRS. So that video remote interpreting is used. And for those telephonic appointments, right? The telemedicine. And that would be when someone, a healthcare provider, places a call to you within your home, gives you test results, things like that. The problem is those interpreters working in the telephonic interpreting or VRS system may not have that specific medical training. And video remote interpreting is very widespread now when you use that in place of an on-site interpreter.
I'd like to talk more about VRI later, but for the moment, I'd like to have a conversation about certified deaf interpreters. I don't know how familiar our audience is with those certified deaf interpreters, or CDI, but I'd like to talk about what the difference is between a deaf interpreter and a hearing ASL interpreter.
Sure, as Kevin, I'll respond to that. The big difference is that the deaf interpreter is a deaf person. They have that native language, whereas a hearing interpreter does not have the same lived experience or the same native use of American Sign Language or the same knowledge and connection to deaf culture, because that is strongly connected to that profound shared experience of growing up as a deaf person in a deaf community. So there are nuances to the use of ASL that are more readily expressed and received through a deaf interpreter, as opposed to a hearing interpreter who learns American Sign Language much later in life. They may started learning in high school or even in college, so that is their second language. So they don't have that native fluency and flexibility that you would see within a member of the deaf community or a deaf interpreter. So there can be subtleties that are missed, nuances that are not present in that interpretation. When a deaf and a hearing interpreter are teamed together and use a teamed approach to the work, we often find that interpretation is far more successful for the deaf people that they are interpreting with. Deaf interpreters are people often want to know when deaf interpreters began, when they began to start working as interpreters. And the truth is, their entire lives, from when they were young. So when they're not understanding what is happening, or their parents are with them and not understanding what's being spoken by their deaf peers or counterparts, then they clarify for them. So they have had the responsibility of clarifying and ensuring communication is working well since they were very young. And they already have the skill set of processing between those languages and those communications just within them inherently. So when you see that hearing and deaf interpreter team, you know that that approach is going to be best serve the community that they are in. And you can see that there are pros and cons to using either hearing interpreter or hearing and deaf interpreter team. But it does feel like much more direct communication. It doesn't require averting your eye gaze, looking back and forth between several different communication participants. So it is a different experience.
Jenny, would you like to add to that?
Yes, I would. You know, hearing interpreters often work with other hearing interpreters as a team, and it ensures the best accuracy of message, as well as helps prevent fatigue in the interpreting process. So using a deaf interpreter is very similar in terms of improving accuracy and understanding person-to-person communication. I hate to say better, but it's better. It is better. And there is deaf extra linguistic knowledge. Hearing interpreters can have extra linguistic knowledge, meaning understanding of the context from our own schema and framework of the world. But when we're looking at a deaf extra linguistic knowledge, that means that that person can give additional information about, again, the nuances and the subtleties of the language. A deaf interpreter is going to align with the hearing interpreter, the spoken language interpreter, in that generally spoken language interpreters are native speakers of that language. And I had the similar experience of working within a family. My family speaks Portuguese. And so I had that same concept of having Portuguese as my native language and clarifying for my family.
Thank you. And we will be taking pauses for the interpreter to catch up because of course we know that it takes time to take in one language and interpret it into another. So thank you for that. Kevin, you had mentioned how deaf interpreters are often have lived experiences of having to interpret very early in life and that sort of thing. We also know that there is something called copy sign, where someone will copy what another person is signing to make it more visually accessible, especially in larger crowded spaces. And so I think that it's important to recognize the need for establishing opportunities for deaf interpreters to become certified as interpreters. What are your thoughts on that?
Again, they have not been interpreting formally, perhaps, but before the advent of interpreter training programs, deaf people have been out in the world interpreting. And you have also been used for their translating skills, for assessment of language capabilities, and we are used as interpreters. And this kind of happened in an organic way and became more streamlined to become a profession. And I believe, oh gosh, maybe around, there were different certifying bodies and certification processes that have come and gone throughout the years. But developing that certification for deaf interpreters wasn't available until about 1998. And since then, those assessment processes have still been going on. There's a new test actually being developed currently for deaf interpreters. There's a lot of focus on, let's see here, from right now, the test is on hold, on moratorium. So that testing process hasn't been released. So we are waiting to be able to release that newly developed test to create more certified interpreters. And I do believe that those numbers will grow as soon as that test is released. I think there are about, all over the country, about 95 deaf interpreters, and there's about 9,000 hearing interpreters. So in the 2020-ish, it was very difficult to get those testing process going, get the results, and to actually grow that pool.
Anything to add, Jenny? My next question is, in terms of healthcare settings, when are we able to identify that a certified deaf interpreter will be needed for that work?
This is Kevin. Frequently, because of the low numbers of deaf interpreters, what you're going to see is the use of a hearing interpreter first. And at that point, the decision and determination can be made whether there are additional supports or deaf interpreters that need to be brought in. So that's generally where the discussion starts. And this is based on where the deaf person is at within that moment. If they're experiencing high levels of stress, they may not be signing clearly. They may be under stress. They may be experiencing pain, have an injury to one of their arms or hands, anything that could make communication extra difficult. We also look at state of mind. If someone is working with an altered state of mind, that's something that you would also bring in a deaf interpreter for. And it depends on their method of communicating and if their signing is within a typical space or not. And a deaf person can be also more attuned to the nuances of facial expression that a deaf person could be giving off. And so that is another reason that it would make it more effective if you have someone who is not showing a lot of obvious expression. But honestly, I encourage in all situations the use of deaf interpreters, but there aren't enough resources. Here in Rochester, in the hospital settings, we have 6 deaf interpreters, and they all work all the time, over the weekends, during the week, weeknights. And, I think it's difficult to find an equivalent to that type of resource elsewhere. But, we work together in collaboration with hearing interpreters and with under agreement with other entities in order to improve the process, but it's always a work in process for sure. And Jenny says, I think that's very important to acknowledge. Where we live, we are very fortunate to be in Rochester. And there aren't just an overwhelming number of deaf interpreters, but compared to where I used to live in California, there were just not resources available. We had to figure out as hearing interpreters ourselves how to handle those types of challenging situations. The only exception was in legal settings where the hearing interpreters we all came to an agreement that we would absolutely refuse to do legal settings without a deaf interpreter. But again, you're looking at that big difference in numbers, and I would love to have a deaf interpreter with me at every appointment, at every assignment. And working with deaf interpreters for me is just the best experience ever. It's a fluid process. It does not require the mental fatigue. There's still processing, but it's just definitely not at the level of someone who is a second language learner. So there are often patients within the hospital settings. And if they are children, especially children who've experienced trauma, we want to have a deaf interpreter. Anyone who is experiencing trauma, people who can't use their extremities, who are experiencing a stroke, who have had cognitive delays or decline. There are all sorts of different resources that can be used, but it's always best practice. Right. And also there are those who, right, deaf people who have another native language that's not English or ASL, or also who don't have a formal language. And oftentimes you have to do some collaboration and discussion beforehand to even determine how to best serve their needs. And it's really a unique team situation when you're approaching those special communication challenges. And especially in the hospital, we see a lot of different examples of this. But it requires a lot of work and mental processing for a hearing interpreter to communicate with a deaf person. And this is a workload that is also fallen to the deaf person to try to process this language from a second language user.
Right. And I would say utilizing signs that are best understood by that consumer and being able to code switch based on their language fluency. There are some deaf individuals who are much more skilled at that and utilizing facial expression and gestural communication for those who have language disfluency. And that can be a lot easier on the patient's eyes in taking in that sort of language rather than from a hearing interpreter. I know that you have had the opportunity to work with deaf interpreters in conjunction with hearing interpreters. I will say that in New Mexico, we have a deficit of deaf interpreters. We did have one certified deaf interpreter at one time who has since moved away, and we have very few deaf interpreters who are not yet certified but working on that goal. So at this point, there are no certified deaf interpreters in New Mexico. So hearing that you have in your area of Rochester 6 of those interpreters is really definitely a gift because that national number is very small. Kevin, you said there were how many?
About
Around
195-ish, yeah.
Okay, around 200 deaf interpreters nationally as compared to hearing interpreters. Jenny?
Yeah, and with the pandemic, we see some improvement in that because with using video remote interpreters, that means you can access those resources from other areas if they're not available on site, which is a benefit of the pandemic.
Indeed.
Yeah.
I'd like to also add for deafblind consumers. It's important to have an on-site interpreter because a video-based interpretation is not going to be successful for those individuals. Do you use deaf interpreters often with deafblind patients?
We do, yes. I mean, it it depends on the area in which they live, but many deaf interpreters do work with deafblind individuals. And again, it's that native language user that makes the difference, and how to use a full range of resources, how to use the appropriate space in which to sign to make it tactily accessible. And they can also include other environmental information using different systems of touch to show what is happening within the setting in the environment, because deafblind people miss that visual information. So we generally do use deaf interpreters to relay that because they're able to do that with more fluency. And what it's not a requirement, and what we look at truly is skill level and being able to work together. Again, such a small number of deaf interpreters that are available out there, and there are missed job opportunities because of that lack of resources, but we're seeing them widen. And this is Jenny. Yeah, at Gallaudet, an RIT, the University of Rochester, we have these deaf interpreters available, which are wonderful. There's a program called Deafblind. Oh, the Deafblind Institute, excuse me, thank you. Deafblind Institute that established a program to train hearing interpreters on how to use approaches like pro-tactile. And many more hearing interpreters now have that training and are able and have deaf community members, people who are deafblind themselves, are now able to then instruct others on how to use that pro-tactile. So we have, train the trainer programs, and that training is starting to spread, which is wonderful because obviously, we want the best interpretation possible for conferences and big events. Deaf interpreters will be hired and flown in to help provide that access for those who are deafblind.
You mentioned a few times now.
Oh, that's for later. It's okay.
One moment.
Sorry.
You mentioned a few times now the deficit of a broad number of skilled certified deaf interpreters available in the field. And at the hospital, in healthcare settings, there often are not certified deaf interpreters available. In those cases, what is the best approach to communicating with patients?
This is Kevin. Yeah, this conversation comes up quite a bit, and I believe that having
Oftentimes, hearing people will automatically make decisions for the deaf patient without including them in that conversation when there's not access available. And so when we don't have a deaf interpreter available, there needs to be a conversation of how do we have access? Is it possible to make this appointment accessible? Do we need to reschedule? Will that add extra time to the patient's waiting for 5 months to get an additional appointment? Would a hearing interpreter be appropriate for this conversation? And so we have to consider all of these factors and take into account the resources that are available. There may also be a CODA interpreter, a child of a deaf adult, who is not deaf themselves, but who has some of that cultural understanding. And so not all interpreters have the same skill sets and basis. So we need to look for a solution based on the resources that are available. And so I would say before deaf interpreters were included as part of the profession of sign language interpreting, this is the kind of conversation we had. And we often saw only hearing interpreters being provided as sort of the best solution. Now we know that the best solution is to have a deaf interpreter. We're also aware that there are not enough of them. And so we need to consider those approaches for effective communication facilitation as the priority in determining what resources to use. And this is Corina. Does Rochester have a nonprofit organization or an agency of any sort that provides advocacy in terms of those situations where there is a deaf interpreter needed, or there are additional communication factors to keep in mind?
We have social workers.
Considering if there is no certified deaf interpreter available, who makes those decisions?
We have deaf social workers within the hospital environment that
Wonderful.
can meet, yes. And so for deaf people who don't have a formal language, who don't use typical standard American Sign Language, they can meet with them and interact with them to make sure that whatever their needs are, they're being met and ironed out. And, you know, then they will have a set schedule with the appropriate resource, and we try to figure out what that appropriate resource is going to look like. And it helps to have support set up for outside of the hospital after discharge, when they're sent home, if they have any home health care needs, that they're not just left alone.
Excellent. I did have 2 additional questions. I would like to take a moment to look at the questions that we're receiving. One question is, when there is an interpreter, could you please explain why some patients don't always work effectively with certain interpreters, why some are resistant to the use of video remote interpreting, and what that process looks like?
Are you asking, I'm sorry, I think, can you clarify? Are you talking about the use of VRI specifically?
One moment, let me pull this up.
Oh, using VRI in lieu of on-site interpreters, I see. Historically, a lot of the deaf community does not maybe understand what the use of a deaf interpreter is for, and there are a lot of misconceptions about that. And especially for a deaf person who does not have a lot of language, a hearing, one moment.
There's a miscommunication. There was a miscommunication amongst our community that deaf interpreters were only used for people who had lower language fluency, or who needed additional help or support in understanding an interpreter. So that was a miscommunication. We also did, in terms of video remote interpreting, have technological issues where the hospital did not have strong enough signals for video to be clear. They did not have mobility in terms of how to utilize screens and tablets and things to make those interpreters accessible. Oftentimes the interpreters who are available are out of state, and so they don't know the local community and their regional use of language. Oftentimes it involves a lot more conversation and expansion on what's going on the deaf patient's part to that interpreter for then communication to be accessible.
And this is Jenny, I agree. Copy that. I just, maybe for a hearing perspective, I think you guys have got it on this one.
Another question we've received is, are CDIs recognized in all states and Puerto Rico? Kevin is saying, I'd like to talk more about what we mean by being recognized. We do have a registry of interpreters for the deaf that runs those certifications. And it is through that certifying body that those interpreters are often recognized for those certifications and those skills. So because CDIs are run through that registry of interpreters for the deaf, there is that recognition of that national certifying body. There are also different states that have various rules and regulations in how interpreters are credentialed and where they are able to work. I know that Pennsylvania does have certified interpreters or provisional interpreters. Provisional interpreters meaning those who have graduated from a training program but who have not yet taken or passed that certification exam. So they have a certain number of years that they have that opportunity to take that certifying exam. Deaf interpreters don't have the same provisional opportunities as hearing interpreters do. And so we've had to do some advocacy and support in explaining what exactly deaf interpreters look like and how to best utilize them within those states that have certain laws. I would say in terms of Puerto Rico, I can't speak specifically to what those rules are, but I would say that if a person is aware of a deaf interpreter, they would know to ask for one as needed. A lot of the deaf local interpreters are familiar with DIs, who are deaf interpreters who are not yet certified, and so they have more of that community-based knowledge of who is available to interpret. So we do have those who are interpreters who do not take those certifying exams, who do work as deaf interpreters in the community, but aren't recognized as CDIs.
This is Jenny. I want to, I actually had something come to mind from our previous question I wanted to elaborate on, because we have used DIs. It's not a great term, but we have used deaf interpreters. For deaf individuals who can't communicate using a hearing interpreter. I think there is an assumption on the part of the deaf person using an interpreter that there's something wrong with me if you're pulling in a deaf interpreter to provide that support. And I think, that shift is happening now where people are starting to come to the understanding, and there's a shift in culture that it doesn't necessarily mean there's something wrong with you.
In terms of recognizing CDIs, as Kevin was saying, there is a national certification. As I mentioned, here in New Mexico, we have different organizations and agencies that understand that there's not always a certified deaf interpreter. So part of my experience as my job within the Commission for Deaf and Hard of Hearing is advocacy to healthcare providers, as well as various other agencies and organizations, about the use of certified deaf interpreters. And many are not familiar with that concept. And so it's a learning opportunity for them, because there is such a high turnover among healthcare staff as well. I'm often having to re-educate the same locations and clinics on what that process looks like. So it's not an easy job and something that is ongoing. So I would say that even within local healthcare systems, as opposed to a national level, many people don't know about the use of deaf interpreters. I've been working in this field for more than 20 years now, and it's still an ongoing conversation. There are some who are familiar with deaf interpreters who've not yet had the opportunity to work with them.
Even today within our hospital system, we do see that struggle, and it's always a process of continuous education. And there's always a need for more education. And it's hard to know how to get the message through to everyone that you're trying to reach. DIs or interpreters in general, sometimes they're just not called at all. And then patients are forced to write back and forth, and are there communicating about their healthcare without an interpreter at all. It's a process.
I have an additional question, not from the chat, but something that I was thinking of. I'm on a patient advisory council for one of the healthcare providers here in the state. There were two. Unfortunately, one of those councils is no longer running. So I am working with only one hospital at the moment on their patient, family, and advisory council. And so one of the things I've been able to do is go into the hospital and work with those healthcare partners, educating them within different departments, including directors and managerial staff, about a deaf person's perspective as the patient. And so they're able to learn more about what the experience is, because of course, as healthcare providers, they're often familiar with those patients who can hear. but they don't know what it's like to be a deaf patient who doesn't have access. They don't know what it's like to be a deafblind patient who needs that tactile signing, for whom video remote interpreting will not be effective. When we saw the beginning of the pandemic, the use of masks, that really limited communication accessibility as well. So we had to work within the hospital system on implementing changes in some policies and procedures to add access. So I'm wondering if your hospital has had similar advisory councils that can speak on those things.
You know, I think it's the same. What you mentioned, the PFAC, the Patient Family Advisory Council, we have something
Yes.
similar as well. Yes. You know, I don't know the details of their topics of discussion within the committee, but I know they talk about information about accessibility, the difficulty with having enough interpreting resources, also the lived experience that it brings, things that they should be aware of, who should be involved, who the partners are, those types of things. And I would love to see a deaf professional included on the committee as well. In Rochester, the hospital system has about 70 or 80 professionals working within that team, and all of them have opportunities to have a work with assigned interpreters while they are learning what they are doing. So when we're talking about patient care, that I think it's great that we have deaf professionals who have their own assigned interpreters, and then we have patient care committees with deaf perspectives. So those are two different things we bring. And this is Jenny says, yes, absolutely. The hospital has the Deaf Advisory Council or committee, excuse me, and there are people who represent a variety of different interests, you know, who may be community members, stakeholders who work within the hospital setting, service coordinators, interpreters. So it brings a lot of different stakeholders to the table, and they bring a lot of conversation. So there are people there who represent the patients, you know, and who give information and feedback to the hospitals about their experiences to be able to identify and solve problems as they come up. And there are always, every week, there are educational opportunities and trainings and that talk about how to communicate with deaf patients, how to again communicate appropriately, but like Corina said, there's definitely turnover, and it requires that weekly educational effort. Definitely.
I know that time is running short, but I did want to talk a little bit more about video remote interpreting. What does your community know and understand about the use of video remote interpreting?
Jenny, I don't know. I know there's a hearing and a deaf perspective on this one, definitely. More and more deaf interpreters are being utilized through video remote interpreting, meaning that either there will be a hearing interpreter on the video screen signing to the deaf interpreter, or vice versa. So there are multiple approaches there. I'm the deaf interpreter on site, so often I will have a hearing interpreter brought to me through VRI if there's not an on-site hearing interpreter available. In the beginning, it was very awkward. And, you know, of course, over time, you problem solve and you try to figure out how to approach. What does the deaf community know? They need to know they have the right to say no, but understand that they may delay their appointment. If they want an on-site interpreter, they can require that. They can ask for that. They can also state that they're willing to move forward with the video remote interpreting. You know, and it can be difficult and awkward in the providers, nurses, or doctors even knowing how to use the equipment. And then sometimes there are, it just requires a lot of patience because it prolongs the communication experience, and it can definitely be more complicated logistically. But I think what's important is that they have the right to say they do not want that for their access. And I've seen the whole gamut of how this can play out. Jenny, do you have any comments about it? I do. Within my research, I did in my dissertation, I did a lot of research on VRI and identified a lot of problems with its frequent use. Hospitals tend to use it because it's more fiscally sound. Rural areas may not have access to on-site interpreters, and for them, use of VRI is a wonderful resource. Of course, they need to know how to set it up, and that helps deaf people have access to their healthcare. But there are hospitals that will require VRI, and that is problematic because there are only specific situations in which VRI is appropriate use in the deaf world. Now, in the spoken language interpreting world, there are a lot of instances where VRI may or may not be appropriate in comparison to the deaf interpreting world. But there are a list of criteria that would qualify VRI as appropriate. And if they're not met, then it needs to be an on-site interpreter. So what they need is an actual resource, and to give the deaf community a card or some sort of information that they can show that says it is my right to decline VRI services. And there are articles explaining this all in great detail, but there are so many problems with the idea of maybe not having enough high-speed broadband within your facility. There have been lawsuits that have happened with some frequency and really severe issues where people have died or completely misunderstood their diagnosis, been misdiagnosed. There are so many things that can be problematic about the use of VRI. And whether it's appropriate or not appropriate to use, that getting that information out there to screen for appropriateness is very critical. And this is Kevin. I would like to also add that VRI is really is used generally on like an iPad, right? There's a limited view, which means that there are a lot of physical positions a patient could be in if they're on a bed, if they are in pain, if they have to maintain a certain position, can't move their head. For whatever reason, there are a lot of reasons that having this iPad and perhaps even set up on a stand would be not flexible enough to create the access they need. I mean, yeah, those without vision loss, that's obviously a separate issue, but there are a lot of reasons that it's not flexible enough to be used for a lot of different positions, physical positions a patient could be in.
You mentioned various challenges. One issue that we've seen is that interpreters can come in on video from throughout the country and may not be familiar with the regional signs being used or the local deaf community and the way that they communicate. And so there could be an interpreter for here in New Mexico, a patient here in New Mexico who has an interpreter from New York, and that can also potentially cause miscommunications or a lack of information because those remote interpreters are not familiar with local signs. I do see some comments here. Zoe, is now a good time for you to jump in?
Thank you. I was so taken up with the conversation myself that I didn't realize where we were at time-wise. And so I just want to say that, of course, we could continue for another half hour at least, but I do want to wrap it here. for continuation, hopefully next November, because I feel like this is going to become a regular, a recurring coming together and enriching exchange. So I want to take a moment again to thank everybody for being here, for all your amazing input and insights, answering some of the questions that were posed, if not all. And thank you, audience, for joining us for today's roundtable. We certainly look forward for another one in next November, hopefully. And also, we are looking forward to hosting other interesting topics come the new year, 2023. So please, all of you, keep an eye out for those announcements that will continue to come your way. And again, thank you, one and all. Thank you, this fabulous team of interpreters, for being integral to this exchange as well. It's always a pleasure to see you and to have you here with us. Thank you.
Thank you.
Thank you.
Thank you all so much.